Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Exercise and Sports Science at UNC Chapel Hill, and the co-host of JAT Chat. Today, I have the pleasure of being joined by Dr. Sam Walton. Dr. Walton is an assistant professor in the Department of Physical Medicine and Rehabilitation with the Virginia Commonwealth University School of Medicine and a research associate with the Richmond Veterans Affairs Medical Center. He is the lead author of Health Promoting Behaviors and Their Associations with Factors Related to Well-Being Among Former National Football League Players, an NFL long study, published in the Journal of Athletic Training. Sam, thank you so much for joining me today.
Thank you so much for having me, Shelby.
All right, starting with a very broad question for our listeners. What are examples of health promoting behaviors and why do they matter?
Sure. Yeah, that's a great question. So health promoting behaviors are really actions, activities, or lifestyle factors that are modifiable, and they are known to have benefits on health or well-being, or both. In the case of this paper, and predominantly what I focus on in my research, I look at exercise, I look at diet, and I look at sleep as, again, modifiable factors that can improve someone's health and well-being.
A little bit more about the NFL long study. What is the study and what prompted exploring these health promoting behaviors and their associations with subjective outcomes?
The NFL long study was designed to look at brain health in former professional American football players. There are two primary components to the study. So one is this survey, a general health survey that was sent out to a whole bunch of former players. And then there's a second part that's an in-person comprehensive study, clinical program to measure a whole bunch of brain health and other health and well-being information. This paper that we published is from the general health survey itself. And the NFL long study's purpose is really to help inform what we know and what we might not yet know about long-term brain health in this population, as well as to try to identify things that are modifiable or not modifiable that can be contributors to brain health in the long term. And in the case here, I mean, the focus on the modifiable behaviors that we selected, we chose because they are readily addressable. They are not necessarily a primary outcome point of the study when we are looking at things like neuroimaging or disease onset. But we know that they're factors that are outside of the hot topic of brain injury and neurotrauma over years of playing professional football.
And can you tell us a little bit more about the specific factors that you all examined in the study and why those are important?
Yeah, so there's a lot of good evidence in the general population that being physically active and in particular engaging in exercise activities has benefits to multiple facets of brain health in depressive and other mood-related symptoms, in improving cognitive functioning, and then even on the objective side of exercise programs that can help preserve brain gray matter and actually help grow gray matter volumes in the brain, and as well as functional connectivity and white matter integrity. Exercise is sort of a cross-cutting modifiable behavior that could then be used as a lifestyle intervention or even a clinical intervention to target specific non-communicable kinds of issues. So we're talking even outside of direct brain health, cardiovascular health. We add to that, there's maybe a little bit less direct evidence around dietary interventions, but there are diets that are recommended to promote brain health to help stave off cardiovascular disease and potentially even reduce the effects of aging and atypical aging that leads to things like dementia. And then sleep is another cross-cutting behavior. We've got lots of information in the general population, less so in the former athlete population, around what is good sleep hygiene and how does that affect what we would consider brain health in this population. And so we picked these because they are factors that are sort of readily measurable, even basically through a survey like this. But as I'll talk later too, there are certainly more sophisticated ways to measure those. But this is a really good starting point with self-reported participation in these kinds of behaviors for us to get an idea of how they do associate with brain health, while we're also considering all of these things like neurotrauma history and history of other disease and injury and issues.
So sleep, nutrition, and physical activity, things we need every single day.
Exactly right. And despite them being recommended for the general population and really everybody and having some pretty standardized benchmarks to meet, the majority of Americans don't meet recommendations. And So part of this study was to try to explore how former NFL players who have a history of being physically active, who have a history of maybe focusing on their diet and sleep and other behaviors to improve performance through sport, how these things might also look after that period of competitive sport has ended.
And can you tell us a little bit about the outcomes that you were looking at as related to self-efficacy and some of those specific outcomes in the study?
So we selected these as factors associated with well-being, in part because there's a lot of focus in research and clinical practice on things like self-reported cognition, objectively measured cognition, mood-related symptoms, and other facets specific to health. Well-being, I think, is a much less studied facet of a whole person's status. And so the World Health Organization defines well-being as being similar to health, but really in a space where someone has meaning and purpose, they have agency, in this case, self-efficacy, and the idea of social connectedness, of being socially integrated, social health, if you will, is an aspect of well-being. So we picked these measures because we had them readily available responding to this general health survey. We threw in these well-being measures because it is relatively understudied and not understood in this population specifically.
As someone who has interest in sports psychology, this really speaks close and near and dear to my heart. Can you tell us a little bit about what you found in the study, and did you have any surprising results?
The first aim of the study was really just to describe what the players told us they were involved in terms of exercise activities, in terms of their diet quality, and then sleep duration and sleep disturbance. And overall, I mean, I guess I thought that these people who grew up being very physically active would maintain that level of physical activity. And we saw that for the most part, there are a lot of these former players who are still involved in exercise activities, but a lot of them aren't. And in fact, most of them were probably not getting enough physical activity and planned exercise. And on the flip side, a lot of them reported that most days of the week, they're sitting for long periods of time. And there's certainly a new trend in health-related research that it's not just about physical activity, but about physical inactivity that has sort of cross-cutting relations with brain health, well-being, and a number of other clinical type outcomes. So, we really thought maybe we'll see that these people are highly engaged in exercise and they stay that way throughout the adult lifespan. And that wasn't necessarily the case, although it was fairly consistent across age groups in terms of participation in moderate to vigorous exercise. Strength training actually was much higher in the earlier ages. There was a larger proportion of people who were meeting recommendations for strength training, and they were more engaged on a week-to-week basis on average. And then you kind of see that drop off and plateau once the midlife groups were accounted for, and then later life. While this isn't a longitudinal study, the idea is that we're taking these multiple cross sections of ages just to look at what things might change over time, or at least what's associated with the outcomes across these different age groups. Interestingly, for diet quality, overall, it was very consistent across age groups. And similarly, I had sort of anticipated that we would see people who are closer to sport would still have maybe a higher focus on their diet quality early on, and or see that people later in life who might at that point be concerned about their current health status as they're aging and getting older, that there might be some extra focus. And in general, when we look at sort of group averages across these different age groups, there wasn't much difference across the lifespan. And then in terms of sleep, really not a lot of variability there either in terms of sleep duration or sleep quality, except that in the oldest age group, they tended to sleep the longest and sometimes reported lower sleep quality overall. So in terms of surprising findings, I think hard to say with a descriptive study that we were expecting to see something completely, but more interesting, I would say, in this being sort of the first look at former athletes at all of these different age groups and what activities they're engaged in. And then we really wanted to look at, like we talked about before, these factors related to well-being, and how does engaging in these health-promoting behaviors associate with those factors. And if you look at the results in the paper, really the thing that stood out the most is that sleep disturbance within the last 7 days had the sort of strongest relationship with each of these outcomes. And that was for all of the age groups, not just a certain subset. But even things like more frequent physical activity and better diet quality had associations with meaning and purpose and self-efficacy and the ability to participate in social roles and activities. And so it's interesting in and of itself to be sort of confirming what we would hope to find, that these modifiable behaviors, the sort of better approach to a healthy lifestyle, was associated not just with potentially health outcomes, but their sense of well-being.
Thank you for the comprehensive review of the study and the results. Do you have any insights as to why we may see some differences between those who were previously engaging in sport at the NFL and professional level and no longer engaging in some of these lifestyle behaviors later in life?
Yeah, and this is a complicated question. I think one of the limitations of our particular study is that this was a cross section and it was a survey based study. So in terms of actually understanding the real in vivo behaviors of these individuals, we're somewhat limited. But what we are seeing is that in this study, the larger portion, we've had some papers that were published recently around the transition to life after sport and long-term mental health outcomes and the readiness to retire from sport. And these are complicated because I think a lot of these guys, as with many athletes, there's an identity change. There's a shift when competitive sport ends and you get into this phase of post-competitive sport life, that things are different and there's no longer this necessity to be bigger, faster, stronger, or to train for performance. And so I think we see the potential shift in behaviors as people, and this is outside the scope of the particular study looking at transition, but based on our other work and other work in the field, that identity being wrapped up as an athlete and identifying as an athlete can have maybe benefits to staying active, but there also could be potential drawbacks for people who feel like maybe if they didn't have a choice in their retirement, for instance, and now they've got to wrestle with what this new life is like. And so it's not altogether surprising that some people just leave it behind because they're trying to move on to other things. And I think while there were relatively small differences, we saw in the middle-aged groups had relatively less sleep, relatively high disturbance in their sleep, and then particular associations in that middle-aged group with the health-promoting behaviors and these feelings of well-being. It suggests that in that time frame, maybe there's things going on that we certainly didn't measure, like having kids or redefining their career. Things like that could certainly affect their day-to-day life and their capability to have time to exercise. For one, disturbed sleep is a facet of having young children. Speaking from experience, that it's sometimes a rare night that you get to sleep all the way through. So I think there are a lot of things that we couldn't measure here, but in general, I'd anticipate that a lot of the lack of engagement is tied to things like that athletic identity, but also just a general change in lifestyle. And that's where I think something like self-efficacy really becomes important, because if we look at today's athletes, and in particular, those who are high competitive collegiate athletes, they have ready access to healthcare. They have ready access to good nutrition, especially in the top tier schools. And they have a lot of people who are stakeholders in their student athlete health and well-being. That changes once you leave collegiate sport or even once you leave professional sport. A lot of those resources aren't there anymore. And so there has to be a lot of figuring out, where do I find this? And then add to it this idea of social participation. In a lot of cases, people's social circles are their team or people engaged with their team. And so I think there's a lot of stuff for us to be looking into in the future, and especially with prospective studies of looking at the transition period and beyond, to try to understand how these behaviors are all sort of interrelated with health and well-being outcomes as these people age.
Very fascinating. I know we often think about athletic identity as this Hercules muscle and an Achilles heel, where it can help but also hurt. What roles do athletic trainers have in helping to facilitate lifestyle interventions aimed at improving engagement in some of these health promoting behaviors?
Yeah, I think one of the beautiful things about athletic training education and the preparation for our skills as a profession is that we kind of have this niche in prevention. And if we think about the different bands of prevention, at first, I think most people think prevention is stopping something before it starts. But there are also secondary and tertiary prevention aspects where it's recognizing early on that there is a problem and addressing it, being able to acknowledge a problem and treat it accordingly early on, but then also trying to intervene and prevent longer term sequelae or downstream effects of something that happened before. And well, we're not talking about particular injury. In this case, I think this secondary and tertiary prevention lens is helpful here because all athletes at some point are going to transition out of their competitive sport. For some, they may move on into master's level sports, and it's a different level of competition after professional or collegiate play. But for some, it's much sooner than that. So I think it's as early as having conversations about how these athletes can connect to the resources for that time period once sport is gone. They're highly active when they're engaged in their sport. I think some coaching and education really about here's how you maintain a healthy lifestyle and what it looks like beyond the sport period. And I'll give an example. In my first job as an athletic trainer at the University of Maine, there was a student athlete whose sport ended in the fall, and they were in the situation where they didn't really know what to do with themselves. So at the time, P90X was this very popular thing. It was like a 90-day program. It was pretty intensive. So immediately after the season, they went and did all of that. And when it finished, they again felt this sense of, I don't know what to do. And so they did it twice each day. And there was this sort of identity piece wrapped up in, what am I supposed to be doing? And in reality, I'm not trying to speak to the P90X program, but being physically active is certainly beneficial, to a point that this person didn't know what it was like to just maintain health. They were constantly focused on getting better, getting stronger, being more agile, things like that. And so I think it ended up being that taking this person and they got involved in sports, like through the rec department, just to do some other things. And I think that helped them sort of ease into, it's okay to not be intense all the time. And it's okay to not be totally focused on just getting better all the time. It's okay to have that kind of relationship with physical activity. So as an athletic trainer, I was close to this person through the transition period, and we talked quite a bit about this. And they went on to be a physician, and so I'm sure they know quite a bit from that experience and have moved on to work in their sports medicine world with that. But as athletic trainers, we have this relationship with athletes in a lot of settings where we are a point person for them. And that doesn't necessarily have to be limited to their engagement in that sport. And I say this also understanding that athletic trainers are overworked everywhere and spend a lot of time already invested in athletes and teams and the health and well-being of those individuals while they're participating. But I think, maybe there's room for setting up some sort of transitional phase for athletes that are anticipated to be moving on after college or whatever setting it is that we're working with them in. And then I think, it's also trying to mitigate potential concerns that an athlete might have when they get into that later life stage. I'll speak from experience with research participants that I've worked with, as well as people I've interacted with at conferences and elsewhere. There are some athletes who, from collision sports especially, who feel like their bodies are ticking time bombs. That is, they've read a lot in mainstream media that things are just going to get bad, early onset osteoarthritis, potentially long-term effects of brain injury, low back problems because they've been lifting and pushing and pulling for so long. And I think it's really important for us to help imbue this idea that there is some agency over that. It's not just that they have to passively accept life as it happens, but these things like health promoting behaviors are modifiable. And they can be used for lifestyle changes, but also particular clinical interventions if people are having problems to target those. So I think as athletic trainers, whether we're working with active athletes or former athletes, there's a lot of education that can be had about just what's expected of typical aging and what can be done to give that person agency to have some control over their health and well-being. And I'll say that from the light, too, of other work that we've done with this NFL-long study, where we looked at actually most of these same health-promoting behaviors and their associations with self-reported cognitive functioning, mood-related symptoms, and at the same time accounted for their self-reported concussion history. And we observed that despite concussion history, there was still a positive effect to being more engaged in aerobic physical activity, in getting at least 6 hours of sleep per night and having higher diet quality. And this suggests that, we can't modify an injury history, but we can modify behaviors and still improve these really important brain health and well-being.
I really appreciate all of the information that you just shared with us and thinking about not only primary prevention, but secondary and tertiary prevention, and thinking about ways that we can help to facilitate effective transitions for our athletes as they start to transition out of sport. At the end of this podcast, I always like to ask one final question, and it's can you help and can you provide a take home point about your paper for our listeners?
Yeah, I mean, speaking specifically to the data in the paper, modifiable behaviors are promising clinical targets or lifestyle targets for improving multiple facets of health and well-being. And that's supported in this paper. I think it's also important that former athletes, like former NFL football players, recognize that they have some control over these things. And so, the take home is this is interesting and it confirms what we would expect to find in a cross-sectional study like this, but also that you know, we still have our job cut out for us to translate this knowledge to the athletes themselves.
Wonderful. Sam, thank you so much for joining me today. And as a reminder, this article is available free of charge by the Journal of Athletic Training. I highly recommend everyone go and download this manuscript in the journal. Again, thank you so much, and we will see you next time.
Thank you.